My mom was on the chronic disease treadmill. For 40 years, it was one pill after the next. High cholesterol, oh, no problem, here's a statin. High blood sugar, no problem, here's metformin. High blood pressure, ACE inhibitor. Every single time, this is a drug deficiency, no problem, just take the pill. 3 years ago, she's hiking in Northern California, gets a pain in her stomach, goes in, gets a scan at stage 4 pancreatic cancer. She's dead 13 days later. If one of those doctors, instead of prescribing her another pill, said, I'm going to write you a note with a detailed dietary plan, I'm going to write you a note with an exercise intervention. We're going to get control of this metabolic dysfunction that these indicators are representing. This is not a statin deficiency or metformin deficiency. There's clear metabolic dysfunction. And Robert, this is the majority of Americans. 94% of Americans are metabolically dysfunctional. Medicine is what a doctor and a patient determine what can prevent or reverse a condition. And there's significant case law since the 1950s that if food is medically recommended, if supplementation, for instance, omega-3s, DHA, 1,000 milligrams has been shown to be more effective than an SSRI in reversing depression. So if you tie a supplement intervention, vitamin D deficiency, to many metabolic disorders, or if you can tie exercise, which exercise, as Mark Hyman has said, is if you put in a pill, it'd be a blockbuster. The doctors actually can work with patients and write down an intervention. And with that doctor's note, that you can then use your medically advantaged dollars instead of waiting to get sick and buying drugs, which those funds are often used for. You can actually buy your gym membership. You can actually buy supplemental food. You can buy supplements, again, if you work with your doctor.